Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armond Budish, Board of Health Commissioner Terry Allan, and Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana. We will begin today by hearing from our county leaders, and then we will have time at the end for some questions. Thank you, and with that, I will turn it over to Executive Budish.
Thank you, Devin. Appreciate that. Hello, and thank you for joining us today. I'd once again like to start by thanking the Board of Health for their ongoing work to keep residents safe during the pandemic. It's important to thank Commissioner Terry Allan and his team during these briefings because their work has been instrumental in every phase of this pandemic: contact tracing, testing, vaccine distribution. They do it all. Continue to be grateful for their dedication and service, which benefits us all. The Wolstein Center mass vaccination site opened just over 3 weeks ago with two primary goals: increase the overall numbers of people who get vaccinated and increase the percentage of Black and brown people who get vaccinated. On both goals, the Wolstein Center is seeing some success. Since the center opened, over 120,000 people have been vaccinated at that site. A total of 458,000 residents in the county have received at least one dose. That's 37% of our total population. That's not 37% of eligible adults. That's 37% of everyone. And while minorities are still way underserved, we've seen progress there too. For example, the percent of vaccinated people in the zip code covering the central neighborhood is up 71% in the last 3 weeks. In the zip code covering the Kinsman neighborhood, the increase is 77%. In the zip code covering the Collinwood neighborhood, the percentage vaccinated is up 80%. And in the zip code covering the Fairfax neighborhood, the percent vaccinated is up 92%. Now, there's still a long way to go, but the trend is in the right direction. The Wolstein Center has now moved on to the second shots at the mass vaccination center. Therefore, the tens of thousands of people who got their first shot at the site will be getting their second one there as well. But you don't have to worry if you weren't able to get your first vaccine at Wolstein. Starting April 27th, the single-dose Johnson & Johnson vaccine will be given out at Wolstein for the last 2 weeks, with sign-up opening soon. And there are over 100 different vaccination sites around Cuyahoga County with vaccines available right now. While there's a lot of options, the issue is finding an open appointment. One of the easiest ways you can get registered for a vaccine is by calling United Way of Greater Cleveland's 211 helpline. The county has funded extra call takers. They're ready to answer your call and help you all the way through the process of registering for the vaccine. And since we don't want transportation to be a barrier for people getting the vaccine, call takers can also let you know of free transportation options that may be available to you. Over 15,000 people have gotten registered for the vaccine, routed to available providers or provided with transportation through 211. Over 30,000 have received information on eligibility and locations before they were even eligible to get the shot, or were routed to the city of Cleveland for more city-specific vaccination details. With the 211 line, you don't have to frequently check back on websites or social media pages for information on availability. And now the vaccine line will also be available on the weekends from 9 a.m. to 5 p.m., with extended hours on weekdays too, from 8 a.m. to 6 p.m. Now, the vaccines are crucial to stopping the COVID spread and to saving lives. COVID is deadly. More than 2,000 of our family members, friends, and neighbors have died in Cuyahoga County. 560,000 people nationally. It's truly tragic. If you've lost a loved one, to compound the pain and grief, the cost of a funeral and burial can also create terrible hardships. So I want to tell you about the new COVID-19 Federal Funeral Assistance Program. Under this program, you can get up to $9,000 to cover the burial and funeral costs of a loved one, including the casket, burial service, and or cremation. This is not just for people who die going forward. If you paid money for a funeral of someone who died of COVID after January 20th of last year, you can get a reimbursement up to $9,000. There are just a few requirements. You must show a death certificate that says the death occurred in the United States and may have been caused by or likely was the result of COVID-19. You'll have to show a receipt for the expenses, and the federal aid will be reduced by any amount that you've already received from insurance or some other government program for the same expenses. You can apply for this federal program starting Monday. The federal government set up a toll-free hotline to answer questions and to take applications. That number is 1-844-684-6333. That's 1-844-684-6333. And as always, if you need more information, you can always call our 211 line. Most people are not aware that this program even exists. I hope you'll never need it. But if you're eligible, don't miss out. Now I'm pleased to turn it over to Health Commissioner Terry Allan.
Thank you, Executive Budish, as always. Thank you for your kind words about our folks here and the work of the Health Department. We've appreciated you being alongside us and all your staff throughout the pandemic. It's been incredibly critical, and thank you very much. So since our last briefing a couple weeks ago, we've seen our case numbers begin, unfortunately, to trend up, even as our vaccination rates across the county and region have been climbing. While we remain much lower than our winter peak of over 1,000 cases per day in the pandemic, our county remains at red level 3, indicating a high transmission of COVID at 2.4 times the CDC threshold for high transmission. Cuyahoga County currently stands at about 237 cases per 100,000 people, up from 162 cases per 100,000 residents just 2 weeks ago. Governor DeWine has indicated that when Ohio reaches 50 cases per 100,000 residents, that he'll lift all state orders. We're currently trending in the wrong direction in our foot race against the virus and the emerging variants. We have to keep our strong pace to vaccinate as many residents as we can over the 100 locations that Executive Budish noted that are currently available for vaccination across the county. Please know that over 70% of us are within a mile of a vaccine location, a vaccine provider here in Cuyahoga County, and we're very fortunate. More vaccine is being distributed across the state with each passing week, and more providers are distributing those vaccines throughout Cuyahoga County. It's becoming easier to find a vaccine conveniently closer to home. The Cuyahoga County Board of Health, in concert with the City of Cleveland Department of Public Health, our hospitals, community health centers, pharmacies, and others that are all working overtime to expand vaccination access to residents closer to home to stay ahead of this next wave. We're working with the Educational Services Center here in Northeast Ohio to assess interest among high school students age 16 and up in vaccination to meet the governor's request to offer vaccination to this group. Pfizer is currently the only approved vaccine for those 16 and older. Even as more of us get vaccinated, we continue to work as a community to assure that everyone has a fair opportunity to get vaccinated. Partners from local governments, faith institutions, and nonprofits have been working together to promote equitable vaccination access, and we'll continue this important work. On the prevention front, we've all learned together how to best protect ourselves and the people around us from COVID. The collective commitment to masking, distancing, remote work, avoiding large gatherings, case investigation, contact tracing, suppression of disease clusters, and the vaccination program must be sustained. We know that the recent holidays, spring break, and certainly spring fever that people are experiencing now I know everyone is tired of this virus, and oftentimes it can be difficult to sustain these prevention efforts, but it's important to know that all this work that we've done has been important to deal with this emergence of these variant strains, which we'll talk about in a bit. And they've all combined to slow our progress back toward normalcy. These issues around the holidays and mixing and spring break and the like. And we know that people's perhaps reluctance to follow them has been increasing a bit, and we're urging people to go back to what's worked so well for us. We're in a very challenging period of this pandemic, and everyone wants to get past this very difficult year. We must remember that our vigilance has been the way to fight back against this pandemic, and we need to stick with what's been working. We just need to look at CDC data in states like Michigan and Florida and California to remind us that we are not out of the woods. Michigan is seeing case numbers higher than their peak cases in the winter. I want to repeat that again, that Michigan is seeing case numbers higher than their peak cases in the winter. Variant strains like the UK B117 are emerging across the United States and right here at home in Ohio and Cuyahoga County, because that's what viruses do. They shift, they drift, they mutate. The Ohio Department of Health Medical Director, Dr. Vanderhoff, has indicated that B117, as expected, is spreading across Ohio, and soon this variant will be the virus. On the national level, it accounted for 1% of COVID infections in February, and now it accounts for 27% of COVID infections across the United States. Thankfully, the current vaccines are effective against the B117 strain. The county executive and county council, as County Executive Budish noted, continue to fund 211. It's been an incredibly valuable resource for people, those that may have difficulty signing up through the internet for various portals. If they call them, they've got a one-stop shop location to assist them with signing up, as well as links to transportation to any vaccination clinic in the county, and we appreciate that resource. And we continue to work with the County Department of Senior and Adult Services, our community senior centers, the Western Reserve Area Agency on Aging, the county library system, and others to best reach our seniors and others in the expanded eligibility for vaccination. If you've been hesitant to get the vaccine, we urge you to talk with friends and relatives that have decided to get vaccinated. Please join in becoming part of the solution, part of what must be a shared civic responsibility to protect each other. Roll up your sleeve and get vaccinated, because it's our only way out. With the emergence of the variants, it becomes even more important that those infected with COVID-19 isolate themselves to protect their friends and loved ones. Those exposed to someone who's infected should continue to quarantine according to public health guidance. These tried and true public health measures are also very effective in slowing the spread of the virus. I want to remind you on another note that if you have pre-registered with us but received your first dose from a different vaccine provider, we would like to remove you from our list. You can help us by emailing to let us know, and this will allow us to open up a spot for someone else. Please email us at COVID-19-unsubscribe@cuyahogacounty.us. That's COVID-19-unsubscribe@cuyahogacounty.us. Finally, I think it was apropos to receive the thanks and appreciated to receive the thanks from County Executive Budish, because it is National Public Health Week this week. And I want to take a moment to recognize and thank all the local health department staff that have been working so hard over the last year to fight back in this pandemic. Through long days, nights, and weekends, they keep coming back again and again to stop the spread of this virus, to protect the people they care for in communities across Ohio and around the country. Our efforts have prevented the worst. Our hospitals were not overwhelmed, and the extraordinary surge levels seen in places around the country have not materialized here. Most of all, I want to thank everyone who I have worked alongside here at the Cuyahoga County Board of Health for their strength, for their determination, for their commitment to this important cause in protecting the health of the public. And we know our work isn't done now, and we're going to continue to work until we get past this horrible pandemic. It's been said that public health is the greatest story never told. And through this pandemic, we've had the opportunity to show people the importance of public health in their daily lives throughout the work we've been doing. And we're all proud to serve you. With that, I'd like to transition next to our Director of Epidemiology, Surveillance, and Informatics, Jana Rush. Thanks.
Good afternoon, everyone. I know we are waiting to pull up the slides. Okay. All right, so this is our week's Epi brief. So as you can see, the number of total cases that we have reported are 73,464. We have had more cases reported this week than the previous week. And so we had just over 200 new cases reported this past week. So we had 1,051 reported for the previous week, and then this past week we had 1,243 reported. So definitely we are seeing our cases increase. As Commissioner Allan stated, we are currently at 237 cases per 100,000, which is well above the state average. The state average is 183 cases per 100,000, and currently Cuyahoga County ranks as number 8 across the state as far as new cases reported over the past week. As far as hospitalizations and ICU admissions, as well as fatalities, those have all been stable overall as part of the total number of cases. We did see less deaths reported this past week than we had from the previous week. So with our deaths, we have 5 new deaths reported this week, and that's down from where we were the previous week at 33 reported. So we're continuing to see a high level of case activity throughout the county, and that's beginning to slowly go up, and we are slightly higher than where we were in June and July. And so we can go on to the next section. And so for our case demographics, we have not seen a significant shift here. This has been pretty stable over the past 3 months, so not a lot of change. We are currently tracking activity in the western half of our county, and we're seeing more cases. About 20% of those cases are among those that are younger than 18 years of age. So we're definitely paying attention to those trends. But overall, cumulatively, our case demographics have not shifted significantly over the past 12 weeks. We can go to the next section. We can continue on to the next section. Thank you. So this is our Epi Curve. And so as you can see, as I was talking about, we're currently averaging about 200 cases per day currently for this past week. Over the past 6 weeks, we were at a low of about 130 cases being reported per day. And so as you can see with the curve, back in June and July, we're slightly under that 200 mark. So we were at about 150 or so, 130. And if you look at the very end of the Epi curve, you'll see there that now we are beginning to hover over the 200 cases being reported per day. Next section. And so this is our distribution of cases geographically. And as you can see, as I stated, this has been pretty stable once again over the past 12 weeks. But we are paying attention to more activity in the western half of the county, as I was stating before, with those that are younger than 18 years of age. So we're watching that population pretty closely over the next couple of weeks. We'll continue to do that. Next section. Okay, so here is an update on our hospital utilization data. And so we haven't seen a significant increase. So we have seen a slight uptick in critical care adult beds. As you can see, we're currently at 78% utilization. And we've seen a slight uptick as well in the usage for ventilators. And so we're at 32% there. And so it's just a slight uptick, 1 or 2%. So that hasn't changed a lot, and it's been pretty stable again over the past 4 weeks. What we have noticed is that we are starting to see more emergency department visits with folks who are or have symptoms that are consistent with COVID-19. And so this past week, we had an average of 45 cases visits to emergency department room for COVID-like symptoms. And the prior week, we saw about 38 per day. So again, slightly trending upward in people visiting hospitals and utilization of our hospital facilities. Next section. Okay, so this data is in relation to our testing data. So we are seeing, again, a slight increase in our positivity rate for testing within the hospital setting. So last week we were at 5.6%, and the prior week we were at 4.3%. So again, about a 1% increase in positivity rate within the hospital setting for those being tested for COVID. And again, for our nursing home testing, just a slight increase there as well, about 0.5% of increase in the positivity rate for nursing home testing. So we're currently at 8.6% there, but still we're seeing a huge decline in the number of cases that are associated with our congregate settings. So with the vaccination being in motion now, we have seen that drop significantly within our population. So now we're seeing more cases that are occurring within the community setting, as not as much as we're seeing anymore within the congregate setting. So most of this is starting to be community spread, and it's not including our congregate settings. Next section. And so this is our vaccination data. And so as you can see, we are currently, for the Cuyahoga County as a whole, so this first graph shows Cuyahoga County as a whole. This also includes the city of Cleveland. So about a third of the population has been vaccinated, and about half of those people have completed their vaccination. Next section. And so here's the data for the Cuyahoga County Board of Health jurisdiction. So this data covers vaccination that have been administered by the County Board of Health. So as you can see, we have 25,121 people have started their vaccination, and 14,044 people have completed their series. So that's a little bit over half of the population has completed their vaccination in relation to those that we have distributed. And so you can see the race breakdown here: 73% are white, 16% are African American, and about 2% are of Hispanic ethnicity. And so for the age group, you can see there's pretty much an even distribution between two age groups. So the 50 to 59 and the 60 to 69 at about 20% delivery for vaccine that we've administered. And our 30 to 39 and 40 to 49 is about at the 18% mark, between 15 and 18%. So pretty closely on those. So we still have vaccinated the 50 and over population. We've had more vaccination within that age group than our younger population. So now that the vaccine is fully open to all those who are 16 and older, we would expect that more of the younger population and an even greater proportion of the older population will begin to be vaccinated. So I think that is the end of all the information that we have to cover. And I want to say, I know that the county has been working really hard on administering vaccine throughout the population. And I want to give a huge thank you to our preparedness and planning team that works within epidemiology, surveillance, and informatics, Rebecca Heising and Heidi Scaife. They're doing a lot of efforts to really drive a lot of our community planning for a lot of our clinics. And I just like to thank them for all of their efforts. And that's all. Thank you.
Thank you all very much for your remarks. We now have a few minutes for some questions. Just a reminder to please state your name and media organization when asking a question, and remember to stay muted when not speaking. So with that, we can take a question.
Hi, this is Lisa Ryan, and I'm from 90.3 WCPN Idea Stream. Do you have any idea if the problems in the Johnson & Johnson supply chain will affect the Wolstein Center's final 2 weeks?
Thank you for your question, Lisa. I think that a lot of the vaccine the vaccine that's going to the Wolstein, as you know, is a direct federal shipment. And so I think supplying those large megapod sites has certainly been a priority, but we haven't had any indication that that'd be the case. I did see that the issue with the 50 million doses that we saw of concern that I think they had issues with, that Johnson & Johnson has since come in, is now managing the operations at that site. So we have not been made aware that that would be the case. We have certainly just about 2.5 or so, a little more weeks to work through those processes. And so I know that that'll likely be a priority to assure that they finish the last 2 weeks and have the Johnson & Johnson available there.
Hi there, Rachel Polanski, 3 News. My question is for the county executive. When you announced the selection of the Wolstein Center as the mass vaccination site, you highlighted its proximity to underserved communities. But according to the data, only 9% of the total administered at the Wolstein Center has gone to African Americans, while 75% has gone to whites. So it has not translated to increases in vaccination rates in minority communities. What went wrong?
Well, it's certainly, to me, it's a little disappointing, obviously, that we're not at a higher percentage of African American recipients at that center. The selection was made by the state, and that was their stated hope, was that that location would be easier to reach and be more inviting for minorities. We've done a whole lot to try to remove any barriers to that by providing free transportation, by we were able to work with FEMA to get set aside codes so that people could get registered without waiting in line, so to speak. And I think that's all helped. I will note that overall, and I can't separate between the Wolstein Center and other locations, that the trend line over the last 3 weeks has been very, very positive. As I said in my earlier remarks, the percentage of minorities that have been vaccinated at whatever location are way up. I talked about the fact that in Central, Collinwood, Fairfax, and Kinsman, the percentages have ranged from 70% to upwards of 90% increase over the last 3 weeks. So whether it's the Wolstein Center or the fact that we are going out, the Board of Health is going out, we're partnering with community partners like the Urban League and NAACP and others, many of the local churches, the trend line is very strong and very positive in the right direction.
If I may add to the county executive's remarks, I think that's an important point. What we also know, in combination with the resources that the county has provided around transportation and 211 to assist, is that the foundations have created the COVID-19 Rapid Response Fund and have actually enlisted a whole range of agencies that are being funded to help to connect people to community clinics from under-resourced areas. And so what has happened in the process with Wolstein is it's now created the mechanism, the infrastructure to continue support of our goal for equity and access. And so people go to Wolstein, and folks experience that. Their relatives, their friends go, and they have a positive experience with the vaccination. They recognize it's not so bad. Nobody really likes to get stuck in the shoulder, but we get used to it, and it makes a difference for your health. And so we want to encourage people to do it. But the important point is that we continue to incrementally improve, as the executive said, And now we have the infrastructure to help us with the 100 plus locations that we're going to be getting more and more vaccine in the coming weeks, close to home. So I think those are all positive things that are all part of encouraging people to get more comfortable with the vaccine, and we're seeing those levels increase, and I think that's good news.
I might also add, as I said, we've been working with community partners in the minority community, and one of the things we've heard anecdotally is that minority residents are concerned about providing the information that's requested over the phone or online to register. Just today, I've been advised we've been pushing for at least one day that minorities can go to the Wolstein Center without pre-registering and register right there. We believe that based on the information we've been told by community leaders that will help quite a bit. And we've been given a day now I think it's right at the beginning of May where that is going to happen.
Hi, Suzanne Stratford, Fox 8 News. Hello.
Yes, go ahead.
Yeah, I'm sorry. Yeah, Suzanne Stratford, Fox 8 News. I had a question, I guess, for Terry, Commissioner Allan. In light of the current trends and the numbers, is there concern with the NFL draft coming up and what might happen with crowds? And then also, again, with fans returning, to sporting events like over at Progressive Field?
Right. So I think the key to the consolidated orders that the governor just released is that all the masking and distancing requirements are in place, and the issue around gatherings, we're still looking at small groups that are gathering together. That we need to create distance, even as people do look for opportunities in the summer to get together. So there are consolidated guidelines, and certainly I would think in the eyes of the NFL as well as the state of Ohio that having a safe, preventive, focused effort around the draft will be paramount in what they hope to do. Clearly, it's a priority for them. We know that throughout the pandemic, they've been working to assure that those safety measures in place and had a lot of testing protocols as well. I think that there's going to be a lot of effort focused around prevention to allow those types of activities to proceed.
Rachel Polanski, 3 News again. Do you plan on targeting people who live closer to the Wolstein Center for the J&J shots? And how do you plan on doing that?
Well, I think please, Executive, please.
Well, I was just going to say we've been targeting people in the minority community around Wolstein and elsewhere. I believe our county has sent out over 100 text messages reminding people about the opportunity there. We have had people on the streets through our community partners, at grocery stores, at churches. So we'll continue those efforts, and I believe they are having an impact so far. Mm-hmm. Terry, were you going to add anything?
I think that's well said. Thank you.
Any other questions? Okay, well, thank you all very much for your questions. We really appreciate it. That concludes this week's media briefing. Thank you so much for joining us, and we will see you in a few weeks. Have a great weekend.
Now 3 million vaccinations per day, up from 2.9 million last week. 3 million vaccinations per day, and this includes the lower volume days around the Easter holiday. And as the president announced on Tuesday, all adult Americans will be eligible for vaccination no later than April 19th. That's in 10 days and ahead of the original May 1 timeline. Our vaccination program is working. It's accelerating, and we're on track to meet the president's goal of administering 200 million shots in his first 100 days. This is only possible because of our whole of government response,